We all learn how to give injections during our nursing education. In fact, administering injections safely and effectively is one of the basic skills expected of all nurses. But if you don't give injections on a regular basis, you may not feel comfortable with the procedure, and it's possible that you may not recall all of the details of how best to give an injection. However, for nurses who practice in the psychiatric field, it's important to know how to give intramuscular, or IM, injections, because in addition to oral medications, injectable forms are available for a range of psychiatric needs. For example, benzodiazepines, antipsychotics, anticonvulsants, and medications for control of side effects all may be delivered by injection. It is also important to recognize that many psychiatric patients may be fearful of or feel threatened by injections. Some may even believe there is a stigma associated with being treated for their illness by injection. Your calm and confident manner in giving injections will help your patients feel more relaxed. This brief refresher will take you through the important points of administering IM injections in adults and give you confidence that will benefit both you and your patients. An IM injection deposits medication into deep muscle tissue, where it's then absorbed into the circulatory system. The needle is inserted at a 90-degree angle in order to pass through the skin and subcutaneous layers and into the muscle. Muscle is less sensitive to irritating and viscous or thick drugs and can tolerate larger volumes of medication than subcutaneous tissue. There are 4 muscle sites for IM injections: the dorsogluteal site of the upper, outer, posterior buttock, the ventrogluteal site of the lateral hip, the deltoid muscle of the upper arm, and the vastus lateralis muscle of the thigh. It's important to stay within the designated areas in order to avoid major nerves and blood vessels. To do this, you must locate landmarks at each site. The dorsogluteal site is approximately 2 to 3 inches below the iliac crest. Locate the posterior superior iliac spine and the greater trochanter of the femur as landmarks. When you draw an imaginary line between these 2 points, the safe injection site is above and lateral to the line. This area is in the upper outer quadrant of the buttock and avoids the sciatic nerve. For the ventrogluteal site, place the heel of your hand on the greater trochanter, using the right hand for the left hip or the left hand for the right hip. The greater trochanter is the bony prominence at the proximal and lateral part of the shaft of the femur. It overhangs the root of the neck of the femur. With the fingers pointing toward the patient's head, point the index finger to the anterior superior iliac spine and extend the middle finger back along the iliac crest toward the buttock, forming a V-shaped triangle. The injection site is in the center of the triangle. The deltoid site should only be used for small volumes of medication. Expose the patient's upper arm and shoulder with the arm relaxed at the side and the elbow flexed. To locate the landmarks, palpate the lower edge of the acromion process, which forms the base of a triangle in line with the midpoint of the lateral aspect of the upper arm. The injection site is about 1 to 2 inches below the acromion process in the middle of a triangular area. The vastus lateralis muscle is on the anterior lateral aspect of the thigh. It extends from about a handbreadth below the greater trochanter of the femur to a handbreadth above the knee. The width is from the midline of the top of the thigh to the midline of the outer thigh. The landmark for this injection is the middle third of the muscle. In addition to selecting the most appropriate injection site, you should also consider the properties of the medication being administered. Specific properties of medications affect the way they are mixed and administered. Some medications, such as iron preparations and hydroxyzine, are especially irritating to subcutaneous and nerve tissue. Because muscle is less sensitive to such preparations, the Z-track method of injection is used to seal the drug within the muscle tissue when irritating preparations are given IM. To give a Z-track injection with the non-dominant hand, pull and hold the skin at the chosen site about 1 to 1.5 inches to one side. Hold the skin to the side and insert the needle with the other hand. Pull the plunger back to aspirate for blood. If no blood enters the syringe, slowly inject the medication. Once the medication is in, withdraw the needle and quickly release the skin. The medication is now trapped within the muscle tissue and the injection has been successfully delivered. You should also be familiar with the packaging of injectable medications. Injectable medications are packaged in glass vials or ampules, and some come in pre-filled cartridges or syringes. Ampules contain single doses of liquid medication. It is good practice to use a filter needle when preparing medication from a glass ampule to prevent drawing up glass particles into the syringe. Vials are single-dose or multi-dose containers with a rubber seal on top. Vials contain either liquid medication that is ready to use or a dry powdered form that must be reconstituted. Drugs that are unstable in solution are packaged in dry form and must be mixed with diluents for reconstitution. The medication vial label specifies the diluent and amount to be used. Sterile water and sterile normal saline are examples of diluents. Also, because the vial is a closed system, before the medication is withdrawn, air must be injected into the vial. Otherwise, negative pressure results, which makes it difficult to withdraw the medication. Inject the same amount of air above the liquid in the vial as the amount of medication to be withdrawn. The mixture of dry medication with a diluent produces either a solution or a suspension. A solution is produced when a diluent is added to a dry medication and the medication dissolves fully. After mixing, a solution should be clear without any visible particles floating or settling on the bottom of the vial. A suspension is produced when fine particles remain after the diluent is added and mixed. Because the particles may settle in the vial, the suspension must be mixed just before the medication is drawn up. To ensure adequate mixing, be sure to follow the directions on the vial label. Either roll the vial between your palms or shake it vigorously, depending on the manufacturer's directions on the label. Before giving the injection, you should select the appropriate needle size, unless the needle has been provided as part of an injection kit. Needles are available in a variety of lengths and gauges. Because IM injections must reach into muscle tissue, longer needles are required than for subcutaneous injections. The gauge is the diameter of the needle shaft, and the size of the gauge is inversely proportional to the gauge number. The smaller the gauge number, the larger the diameter. Smaller gauges cause less tissue trauma, but larger gauges are required for viscous solutions or large volumes of medication. When choosing needles and syringes, the type of medication, depth of tissue, volume of the drug, viscosity of the drug, and the size of the patient should be considered, as all of these factors affect patient comfort during and after the injection. In some cases, the medication to be injected may be provided as part of a pre-filled syringe or packaged injection set. In these cases, the depth of the injection may need to be adjusted, depending on the needle length provided. Also, safe handling of the needle and proper disposal of the needle and syringe after injection are important to prevent needle stick injuries and transmission of blood-borne pathogens. The Occupational Safety and Health Agency, known as OSHA, and the National Institute for Occupational Safety and Health have set guidelines for healthcare workers to help prevent needle stick injuries. To avoid needle stick injuries, plan safe handling and disposal of the needle before beginning the injection. Use the needle guard or safety shield if the syringe is equipped with one. Avoid recapping the needle after it is used. Dispose of used needle devices promptly in appropriate sharps disposal containers. If a needle stick injury does occur, it is important to report it promptly in order to receive appropriate follow-up care. Now that we've reviewed some of the general information on giving IM injections, let's review the actual process for giving an IM injection. First, identify your patient and explain the procedure, and then wash your hands. Check the medication order and compare the name of the medication ordered with the label on the medication vial. If the medication has been reconstituted, roll the vial between your palms to mix a solution or suspension. Cleanse the rubber seal of the vial with an alcohol wipe. If the vial is unopened, remove the cap first and then cleanse the rubber seal. Remove the cap from the needle and draw a volume of air into the syringe that is equal to the volume of medication to be withdrawn. Insert the needle through the rubber top of the vial and inject the air into the airspace in the vial, not into the solution, to avoid creating bubbles. Now invert the vial and make sure the needle tip is in the solution. Withdraw the ordered dose of medication by pulling back on the plunger. To remove any air bubbles that may have formed in the syringe, gently tap or flick the barrel of the syringe with a finger of your free hand while continuing to hold the vial in the inverted position. Bubbles will rise to the top of the syringe and can be expelled back into the vial by slightly depressing the plunger. Recheck the amount of medication in the syringe and draw more solution into it if necessary. Remove the needle from the vial and very carefully replace the needle cap. Put on gloves. Locate the landmark for the injection site. Cleanse the site using an alcohol swab and a circular motion from inside outward. Remove the needle cap and hold the syringe as you would a pencil. Spread the skin with a non-dominant hand and insert the needle in a single, smooth, dart-like motion at a 90-degree angle. Quick insertion of the needle causes less pain than pushing the needle in slowly. Pull back on the plunger to check for blood. If blood is aspirated into the syringe, that means the needle is in a blood vessel. Injecting directly into a blood vessel can cause a rapid drug response. Careful identification of landmarks at the injection site can prevent entering a blood vessel. If blood is aspirated, do not inject the medication. Withdraw the needle, dispose of the syringe and medication, and prepare a new dose. If no blood is aspirated, slowly inject the medication and then withdraw the needle. Place the alcohol swab over the site and apply gentle pressure. Do not massage the site. Dispose of the uncapped needle and syringe into an appropriate sharps receptacle. Remove the gloves and dispose of them and the alcohol wipe, and then wash your hands. There are some additional points to remember when giving an IM injection. Patients with psychiatric disorders receive injections for many different reasons, including regular therapy and acutely for agitation. Consideration should be given to the patient's mental state when preparing and administering an injection. If the patient is obese, use a 2 to 3 inch needle to ensure that the medication is injected into the muscle and not fat. Medications injected into adipose or fat tissue are not well absorbed and may cause tissue damage and pain. A thin or elderly patient, however, may require a shorter, smaller gauge needle and may not be able to tolerate more than 2 milliliters of medication by IM injection. When patients receive repeated IM injections, it is important to rotate injection sites to prevent hardening of the tissue or abscesses. Alternate sites each time injections are given. Indurated or hardened tissue and scar tissue do not absorb medication well. These areas should be avoided, as should bruised skin or sites of infection. Common local reactions at the injection site include redness, temporary pain at the site, and minor swelling. This refresher has taken you through the steps and techniques for giving IM injections. Following the steps and knowing the proper location of the landmarks for the various injection sites will help you to perform this basic nursing skill safely and with the least amount of discomfort to your patient. Not only will you feel more confident with this procedure, but your calm and confident manner will help your patients feel more relaxed too.